Hello, welcome to my presentation regarding the integrative review findings of my topic of virtual reality and nursing education. Virtual reality is an emerging and popular technological advance that is being used in nursing education as well as clinical settings for education. It creates an immersive, simulated experience that allows learners to learn from experiences as they would in real life. Virtual reality delivers enhanced simulation methods, and it benefits the learners by allowing them to advance their confidence, their skills, and competency in their clinical roles. Virtual reality the origins date back to the mid-20th century, but it didn't become significantly popular in research until the 1980s. Research led to the development of gaming, which were huge advances for the retail industry. After gaming, there was additional research that was done that showed early indications of effective learning, and during this time it was compared to the traditional content delivery methods in academic settings. During this research, there were many advantages that were noted, and therefore the use has been adapted to nursing education settings, as well as education settings in the clinical setting. It is being used in the clinical education setting to help with the training and onboarding of new hires, especially those who have competency-based approaches to onboarding. For example, in my HCA facilities in the Center for Clinical Education, we use virtual reality to train new hires and to maintain competency on fire safety in the OR. Our program provides a very immersive experience, and you literally feel like you are sitting in the OR. You put the headset on and you use the hand pieces with the equipment, and you literally pick up the fire extinguisher, and then you have to pull, aim, squeeze, and sweep and do all of those things. And it's been very beneficial to our new hires, and they have actually requested additional scenarios to be uploaded into these headsets. They said that they preferred that over sitting in a classroom and trying to learn these skills because it was more engaging and it helped them learn more productively. The EBSCO search engine was used as provided through our library at University of West Georgia. Databases included in the search are the Cumulative Index to Nursing and Allied Health Literature, also known as CINAHL, Medline, and ProQuest. The keywords used in this search included virtual reality, effectiveness, and nursing education. The initial search returned 284 results. This is a visual of my Prisma flowchart for identification of the search process. Articles were excluded if they were published before 2018, if they were written in language other than English, or if any other keywords other than those identified on the previous slide were used. This reduced the search to 58 results. The final selection excluded articles that were not true to research, those that were redundant, and those that are non-nursing related. This yielded 15 eligible articles, with one elimination due to faculty focus on the perception of the use of virtual reality. A total of 13 articles were used in this review. Of those 13 articles, there were 2 mixed methods, 4 quantitative studies, and 7 qualitative studies that included descriptive and theoretical. A literature matrix was used to categorize and organize the data according to the type of research, the purpose of the study, the design, and any relevant findings that were noted. In this process, there were 3 themes that could be identified from the literature. The themes were then displayed into a table to help the reader or myself be able to synthesize the literature. The themes were identified as positive experiences, challenges associated with virtual reality, and future implications of the use of virtual reality. Positive experiences were plentiful. The use of virtual reality technology can be helpful in the learning process, and it creates a dynamic learning environment. Simulation activities using virtual reality can provide a substitution to improve skill competency in nursing students and deliver cost-effective standardized clinical training. Several studies were completed, and researchers utilized an experimental study to determine and prove that virtual reality approaches to content delivery have a statistically significant improvement over those with traditional lecturing methods. Other studies also proved there to be significant improvements in student knowledge application when using this technology over using computer-based lecturing, and go on to support that virtual reality is relevant for the nursing practice and nursing education because of the many benefits it provides to the learning process. Virtual reality is noted to contribute to theory development and knowledge application, and is reported to be better understood by learners versus traditional didactic methods. Virtual reality is also being shown as the most effective delivery method in improving one's cognitive outcomes, especially in regards to theoretical knowledge. It is said that repeated exposure to theoretical content and clinical skills facilitates connections to theory and practice through the continuous immersive qualities of virtual reality. It also encourages learner development and development of interpersonal and clinical judgment skills. There are several challenges presented in the literature as in regards to virtual reality. There are several physical aspects that are reported, so adverse effects such as motion sickness, headaches, and some sweating and dizziness. There's also some emotional distress that was reported. There were technological challenges, and these were reported as lack of familiarity with the equipment and the technology. Some of the reports showed that there was inability to hear, which led to distraction and it interrupted their learning process. And then there were increase in frustrations due to the time that it was taking to troubleshoot the equipment. And then the financial constraints. There was the cost of integration. It was also shown that there was a report that it was expensive to train staff and maintain that certification. And then the software upgrades and equipment maintenance are also noted to be costly. Current use of virtual reality. The research identifies several beneficial uses in healthcare training, patient education, and clinical competence. In healthcare training, we're currently seeing virtual reality used in perioperative settings, specialty areas, and even in dental technology. As far as clinical competence, research supports the use of virtual reality with learning IV skills and demonstrating them. It also is being used in teaching assessment skills. And then in patient education, it's being shown to help with the promotion of wellness of patients by allowing them to put on the headset and be immersed in a situation involving their condition. It's allowing them to walk a mile in their own shoes and understand how this disease process will affect them, and some key education points. On the flip side, it also allows our nursing staff to do the same, to be able to understand a patient condition better. Future implications, there's several suggestions for research to continue to look at the effectiveness of learner outcomes and their perception of the use. Virtual reality changes empathy and communication development, but it is suggested that there's research that actually focuses in on that. An additional use or research is, or suggestion is looking at the health promotion of patients, and then looking at development of content for each specialty area of nursing. In conclusion, virtual reality is an immersive, engaging, and practical technology that provides significant learning experiences for learners. This integrative literature review has revealed 4 themes from studies published between 2019 and 2023. Research supports future implications for guidance and specific uses of virtual reality in the nursing education setting. Virtual reality in nursing education is practical. It allows for risk-free skill practice and development, and it promotes significant learning. Here are my references.